We're going to look at pulmonary ventilation, which is just a fancy way of saying breathing. Now, keep in mind when you inhale, that is inspiration, and when you exhale, that is expiration. So, breathing in and breathing out. One complete breath in and out is called the respiratory cycle, and most adults in 1 minute breathe anywhere from about 12 to 15 times per minute in a resting state. When we do forced expiration, that's like blowing out birthday candles, blowing up a balloon, coughing, playing a wind instrument, sneezing. You're using additional respiratory muscles in order to do forced expiration. Okay, let's look at some muscles. And the normal muscles for breathing are going to be the diaphragm. Okay, so here's the diaphragm. And the intercostal muscles. Okay, the external and internal intercostal muscles. So with regular breathing, with normal breathing, you're going to primarily use the diaphragm and the external and internal intercostal muscles. The rest of the muscles that help with breathing would be considered accessory breathing muscles to help with that forced expiration. Okay, the external intercostals allow you to inhale. Okay, the external intercostals allow you to inhale, and the internal intercostals allow you to exhale. When you inhale, the ribs actually go up and out. Okay, when you inhale, so take a deep breath, the ribs go up and out, expanding the volume of the lungs and expanding the rib cage. When you exhale, you're using the internal intercostals and the ribs will go down and in, decreasing the volume. The ribs, the lungs themselves, inside the lungs, they don't have skeletal muscle, so the lungs do not ventilate themselves. Okay, the lungs do not ventilate themselves. However, they do have smooth muscle. Okay, remember our three muscles: skeletal muscle, cardiac muscle, and smooth muscle. Smooth muscle are all the tubes inside of us: our large intestine, small intestine, the esophagus, the bronchi and bronchioles that are in the lungs. These are all tubes. They do have smooth muscle, which means they do have the ability to contract. So in the lungs, the tubes will either be nice, they'll be nice and open, so that's bronchial dilation, or they will close down, bronchial constriction. Okay, this adjusts the diameter of the airway and does affect the speed of airflow. So for example, if you're running, you're going to have increased heart rate and increased breathing, so you want the tubes, the bronchial tubes, to open up to allow for better airflow. But the actual breathing itself does belong to the skeletal muscle of the trunk. Okay, some accessory breathing muscles would be the sternocleidomastoid. Okay, so the SCM. The scalenes. Okay, there are three of those: the anterior, middle, and posterior scalene. And the scalenes do have a rib attachment, so therefore they are able to elevate the ribs. The sternocleidomastoid has a thoracic cage and rib attachment, so it's able to, and clavicle attachment, and it's able to lift the rib cage, so it's considered an accessory breathing muscle. We also have the pectoralis minor. Okay, the pectoralis minor, which has a rib attachment, and that is also considered an accessory breathing muscle, and it can help to elevate the ribs. The abdominals, the rectus abdominis, also attaches to the ribs, so that makes that one an accessory breathing muscle as well. All right, and another thing about the diaphragm is when you breathe in, okay, so inhale, the diaphragm actually moves inferior. Okay, when you inhale, the thoracic cage essentially increases in volume, and one of the things that helps with that is the diaphragm will move inferior, okay, moves down on inhale. And then when you breathe out, okay, when you exhale, the diaphragm moves superior. Okay, when you exhale or breathe out, the diaphragm moves superior, helping force the air out of the lungs. When you have increased thoracic pressure, increased abdominal pressure, this is called the Valsalva maneuver. Okay, so it would be like bearing down. So an examples would be childbirth, urination, defecation, vomiting. Okay, those are examples of what's considered the Valsalva maneuver. And sometimes you can actually use that as a test on people. You can have them bear down to see if it causes any pain in their body. Breathing is under neural control, so keep in mind the brain controls everything in the body. So the nervous system is the master controlling system of the entire body, and it's the most important of our systems, so your brain and spinal cord and all the nerves that go with it. Okay, also keep in mind we have voluntary and involuntary to the nervous in our nervous system. Okay, with our nervous system, we have voluntary and we have involuntary. Okay, voluntary is skeletal muscle, which means we choose to move on purpose. Okay, so voluntary, we choose to move on purpose. And involuntary is the subconscious part of the nervous system, which means it's just done for you, so it's automatic. So an example of that would be your heart. So you don't really have conscious control over your heart. The heart just beats for you. Okay, so that's the involuntary nervous system. When you eat food and the food gets into your stomach and all that smooth muscle control and all those digestive juices and the food moving through all your tubes for absorption and the nutrients and all that's involuntary. Okay, so breathing is unique where it's both. So you have, you can breathe on purpose. You can control your breathing because skeletal muscle controls breathing, but it's also autonomic. Okay, there's a part of your nervous system that just does it for you. All right, the nervous system is further divided into sympathetic and parasympathetic. Okay, sympathetic is fight or flight. which is your stress nervous system, and parasympathetic is rest and digest, which means it's the relaxing. Okay, the parasympathetic is relaxing nervous system, and the sympathetics would be the stress nervous system. So in sympathetics, breathing would go up. So you would have increased breathing, increased respiration, and all that. In parasympathetic breathing, you would be calm and resting breathing. Okay, so there's a quick review of and reminder of nervous system stuff there. All right, so the brain via the brain stem is going to be responsible for the respiratory center and breathing regulation in the body. Okay, this is done via the medulla oblongata and the pons. Okay, the medulla oblongata would be this part of the brainstem. Okay, this part of the brainstem, and then eventually it turns into the spinal cord. Okay, so at some point, and it's around the foramen magnum in the skull, the brainstem then tapers in to the spinal cord and goes all the way down to L1, L2. That's where the spinal cord ends, and the continuation of the spinal cord is the cauda equina.